There you go. So good morning or good afternoon, everyone, depending on where you are in the world. Thank you for joining us today for our next in the Lessons from the Field series that we've been doing. I'm Matthew Caffey from Genetic Alliance, and I am happy to introduce Brenna Bentley, who is here with us today to present. Brenna is a board-certified genetic counselor and patient research coordinator at the United MSD Foundation. Brenna received her master's degree in genetic counseling from the University of Alabama at Birmingham in 2020. In addition to her work at the foundation, Brenna also works full-time as a full-time genetic counselor for MedNeon, seeing patients in a clinical cancer setting. Currently lives in Auburn, Alabama with her husband and 2 cats. I hope one of them at least makes an appearance during the presentation. That would be lovely. But Brenna, I'll hand it over to you in advance. Everyone who's just joining, feel free to put questions in the chat if you have any. Brenna's indicated there may be some time that's at the end to either unmute and ask them or read them from the chat. But besides that, Brenna, feel free to take it away.
Sounds great. I actually purposefully shut the cats out because they would be all over the screen, but they're around, so we'll see if they make a breakthrough. But I'm going to go ahead and share my screen. Thank you so much for having me today. I'm really excited to present our ambassadors program, and maybe it will inspire some of you to think about starting your own program. So I was going to introduce myself, but Matthew's already done that. But my name is Brenna Bentley. I'm currently in Auburn, so you're seeing me in my office. I work remotely. And I do work full-time in a different setting, but I'm very happy to be a part-time staff member at the United MSD Foundation as a patient research coordinator. However, I'm not going to be talking about my research efforts today. I'm really going to be focusing on our ambassadors program that we launched earlier this year. So I have no conflicts of interest to disclose. My agenda today is I am going to spend some time talking about advocacy in the context of rare disease. So I know that part will be really preaching to the choir, so I won't be super in depth. Then I'm actually going to take a turn and talk about PreHealth programs and some of their requirements. And then the meat of the presentation is going to be spent on our ambassador program, what we've done with it so far, what we've learned, and then what we hope will be next for us. So thinking about the rare disease fight and initiative, and these items are all going to be really intertwined. But as all of you know, it can be quite a diagnostic odyssey to officially get a diagnosis in the rare disease space. For some people, it might be starting to get a little bit faster as we have things such as newborn screening and whatnot taking off, and genetic testing is becoming more accessible and affordable. However, still for a lot of people, it takes a while to finally get an answer. Additionally, while collectively rare diseases are large in number, individually conditions relate to very small patient populations, which can cause difficulty when pushing forward initiatives, increasing awareness, and having treatment options available. Rare diseases as well typically have limited support resources. So for a lot of places, if your organization might have been the very first organization that ever focused on the condition that you're working on, and that can cause a delay, right? You have to set up the organization, you have to get people put together, you have to connect individuals. So it's definitely part of the story. Again, all of this is very intertwined, but there can be a lack of funding for different initiatives that you want to put forward, whether that be community-based or research-based, which can cause complications. And there's also a lack of treatment options. So once you've gone through this, you've found a diagnosis, you've found your people, the question is what is next and what do we do about it? And all of this is also just compounded by a general lack of awareness about your condition or about rare disease as a whole. And these all just circumvent through each other, right? Lack of awareness leads to still having a small population and maybe taking longer to get a diagnosis because people aren't aware about the condition. They all just, feed into each other and create the problem over and over again. And again, I know I'm preaching to the choir here, and rare disease organizations do a really great job of connecting patients, organizing research, pushing that forward, and in general, spreading awareness about their condition. But they do all of this while facing a lot of strain, such as things we've already talked about, right? Having limited financial resources, having a small patient population, and then also typically having a small staff. Now that might not be universal, but at least for ours it is, and for several it is. So you've got big dreams and a lot of things to accomplish while having relatively a few people to be able to do that. So switching Switching sides a little bit, thinking about pre-health students, there are a number of pre-health fields, right? There's genetic counseling, there's medical school, there's physical therapy school, there's physician assistants, there's dentistry, there is pharmacy, right? You could go on and on of a number of ways that these are eventually professions that in a lot of ways touch rare disease in a lot of different spaces. And to get into these programs, to actually become these professionals, all of these programs, and I've just pulled out a couple of examples here, have a common theme in addition to, their coursework and needing to have tests, but needing to identify having volunteer experience, having advocacy experience, shadowing in that field, all of things which can be really difficult to come across, but are essential to really figuring out if this is a field that they want to go into and something that they're passionate about. So there's blockers, though, to obtain these experiences, right? There's limited shadowing and volunteer experiences available, right? This could be because there's not enough providers to be able to take the time to have these students shadow them, right? They're very busy. They might be shadowing current students already in a program, so they don't have the ability to take in an undergrad student. There is time constraints on the ability to do this, right? They have a very small time that students need to be collecting these hours before applications come in. And there's also location constraints, right? If you're a student who has big dreams to go into these fields, but live in a very small town without access, that's a problem. And where it would be a presentation in 2021 without COVID coming up, right? This really just compounded these issues even more. Students who might be able to start looking into this might not be aware of the opportunities that are available to them. Maybe certain things are really well advertised while others aren't. There's a lot of people interested in a small number of spaces for these opportunities. And in general, they want a meaningful experience, right? They don't want to just check a box by doing something that, I needed for advocacy, so I picked this because it was nearby. And now I've, got that. They are really going to have a more meaningful experience if it's something they're connected to. So with all of this in mind and sort of tying it back together, patient organizations and students really are the perfect partners, right? Patient organizations, they need advocates, they need to build awareness, and they need partners to help them carry out their tasks. And students really need real-world experience, and they need opportunities presented to them. So that brings us to the United MSD Ambassadors Program, where we're really trying to address this problem and create connections between these two groups. Just a quick background so that you have a little bit of an idea of where this is being carried out and the organization that's doing it. The United MSD Foundation, we were established in 2016 after Amber, who is our executive director, her daughter Willow was diagnosed with MSD, which is multiple sulfatase deficiency, but will remain to be MSD for shorthand for the remainder of the presentation, was diagnosed when she was 2. At this time, there was one other family in Ireland that she was able to connect to who had started an organization the previous year, so in 2015, but that's it. She didn't know of any other US families. There was not a clinician actively working on MSD in the United States. There was one who had found the gene in Italy, but it was purely on a research basis. They weren't seeing patients clinically. And so she was very frustrated and decided she was going to take this on, as I'm sure all of you have felt when deciding to create your organizations. The organization is located in Ocean Springs, Mississippi, and there are 4 staff members, but only 2 of whom are full-time. So we also are facing limited resources and limited staff to carry out all of the big dreams to cure MSD, to provide hope to families, and to push research forward. So big dreams, but not a lot of hands. And so some of the goals of the ambassadors program is we really wanted to identify passionate students who were really interested, they were engaged, they were excited, take them in and educate them about rare disease, obviously through the lens of MSD, and then equip them with resources to go out into their own communities to advocate for us and to spread awareness. So, kind of creating a little ambassador army to take on a national reach that we could no way do on our own. And so to do this, we sent out applications in the summer of this year, 2021. So this is not a, long-standing initiative. We're still new. And so what we did is we pushed it out to pre-health students was our focus for this first year through channels that we had connections with. So being a genetic counselor, I had lots of connections through NSGC and other genetic counseling program directors that could then distribute it to their current students or students who had reached out to them saying they were interested in the field, but didn't know where to go, how to get experience or where to go next. We had some connections with different pharmacy programs, a few medical schools, and then of course we pushed it out through our social media, and our executive board of directors, but it was sent to them as well, and some of them had connections with students they knew were interested, and so it was sent out that way. And from our first round of doing this, we received over 40 applications for the ambassadors program. And we were really worried we wouldn't get enough initially to really carry this out. And then we kind of were faced with the pleasant problem of having actually too many that we could sustain for the first year on our own. And so the applications were, done on Google Forms. It wasn't, some high tech, occurrence. We put it together through our own. They captured basic demographic information and 3 short answer questions. And then we're also sending in their CVs or a copy of their current resume. And we ended up selecting 20 student ambassadors for our first year. And this ended up representing 17 states, which was great. Some of the states which we would have had no connection to otherwise. Like Idaho, maybe some of you guys are in Idaho, but we didn't have any connections to Idaho. So we were very excited to find someone who was there. And this part of these 20 included 3 current medical school students, 2 MDs and 1 DO track, 2 current genetic counseling program students, and 3 current pharmacy students, and then 12 students who were looking to get into these fields. So we were very excited. Because the idea would be we're planting a seed, right, in 20 people. But the idea would then be they're going to go into school, they're going to have classmates, they're going to enter their career and have colleagues. And our hope will be that, we're planting the seeds, but they're going to grow the garden of awareness essentially as they move forward. So it's really, an investment in them. So I just pulled 2 randomly. So, we're not playing favorites, but 2 of our ambassador students to point out. The first is Ty up at the top. She has a really interesting story. She's currently a junior in college and she works as a pharmacy technician and is hoping to go to pharmacy school after she graduates. But she actually heard about MSD when she was in high school, and she and a couple of her classmates sold grilled cheeses at her high school for a fundraising event for us, and then donated it. And they drove all the way from Texas to Mississippi to actually meet Willow when they were in high school. So she's been an advocate for us for a really long time and was really excited when we announced this program as a way to, further get involved with us and learn a little bit more. Sonia just found out about us through this program, and she lives in Colorado, and she's actually already graduated from college and is currently working as a genetic counseling assistant at a large genetic counseling large genetic counseling company. So where she interacts with several current, professions or professionals, and she's hoping to become a genetic counselor and is currently going through the application cycle right now. So once we got everyone, they signed confidentiality agreements because we knew that they would have access to some of our families through different opportunities. And we wanted to make sure that that tone was set very much upfront, that these were private stories. And while you could share the idea of stories, we didn't want names and things to be attached to them to connect or to maintain the privacy for our families. They attended one orientation that was offered at 2 times because it was a lot of people to get everyone on one time slot, where we really touched on the foundation's goals and their missions, had time for introductions to build some preliminary relationships. And right off the bat, we had a family who was interested in telling their story and really, setting the tone for what we were hoping to accomplish here. We divided them out into family groups, and this is just as much for us as it was for them. So there was 4 of us on staff, and so each of us got 5, and we spend time really within these groups getting to know the 5 really well. So it made it a much more manageable task to try to get them to know them, understand their strengths and their weaknesses, and figure out how to connect their interests to what they could do in their own communities. So we really spent time, like I'm saying, building connections. So being through the family groups, they meet monthly one-on-one with their family group lead, so a staff member. And this is only like a 20-minute check-in, so it's not a huge time constraint for our staff, but it gives them a chance to figure out, what did you do last month? Did you talk to MSD about anyone? Have you thought of any groups that you might be interested in having you present on the condition or the foundation? Have you, found any researchers or read an interesting paper, et cetera? Just getting a chance to check in on how things are going and brainstorm for the next month. And through these monthly conversations, we're really getting to know them better. We found people who are actually really talented in TikTok, and we were like, great, we don't know how to work TikTok, but we know it's a great social media platform. Like, let's figure out how to make that connection. Or we found people who work at large genetic testing companies who interact with a number of researchers and genetic counselors and physicians. And we're thinking about, all right, let's see if we can get onto one of their, journal clubs or their group meetings and do a quick presentation to them. So they're really getting our foot in the door in a lot of places that we otherwise wouldn't have had access to. So they've been, there have lots of opportunities for them to be engaged. So we hold family meetings. So our families who are interested in telling their story and are comfortable with doing that. There are Zoom meetings that occur every so often, and a small number of our student ambassadors are able to attend because we don't want it to be overwhelming and we really want it to be an intimate setting. So they're able to hear the family stories, get to ask questions, and this is really allowing them to understand what MSD is on a very personal level and a day-to-day life experience versus, the description they read in the textbook of like what it is. And this really, just turns around and helps them advocate and share awareness because they have a much more personal connection to this now. They know the family behind it. They've seen a child. They understand what's going on. They have peer interactions, right? These are all pre-health students that are very interested in moving forward. They're able to lean on each other's experience, go through application cycles together, figure out what's best. We have one group of genetic counselors that's actually going to be presenting to over 100 pre-GC students through a Discord channel. So they were able to get together, combine interests, create a presentation, and now they're going to go on and plant seeds for 100 more pre-GC students. So really being able to turn that around. So we're very excited about that. And that's occurring at the end of October, if anyone's interested. And they also are serving on a number of our committees. So we have a conference that we're holding in April. They're helping us organize that. We have a development committee. We have a family outreach committee where they're able to help generate resources that our families might want, like a list of mental health resources or flyers for their communities, etc. And I'm also really proud about the newborn screening task force, but I'm going to talk about that in just a second. So they're also engaging in a number of ways. So some of this will be repetitive, but it's a nice summary slide. So I wanted to go ahead and include it. So they engage with us through their monthly meetings, which we've already talked about. We have a number of ways that we've increased communication. So we have a Slack channel and we're able to divide if anyone's familiar with Slack, there's different channels that you can create. So we've got ones for the family groups. We have one for, pre-GCs, for pharmacy, for MD. We have channels that have been created for the different committees that they're serving on or task forces. So really just a way to engage and encourage them to talk amongst themselves and create ideas. They're huge on our social media, and I'm going to show you that in a minute. They're sharing our content, they're commenting on it, they're liking it, they're pushing it out, they're creating conversation. And I've got some numbers that break that down really well in a second. Oh, and they're increasing our fundraising reach. They're holding fundraisers for their birthdays or pushing forth different fundraising campaigns that we have as well. They're engaging in their communities. I just gave the example of the genetic counselors that are about to speak virtually to 100 more pre-GCs. And that's just one example. They've got us in front of junior leagues and in front of, oh gosh, I forgot what the other one is called. It's more of the different community groups that serve. We've also had the opportunity to build larger connections. We have one who works at a biotechnology company, which has been really helpful, and 3 that work at different genetic testing companies. So again, for sponsorship for our upcoming conference and different things like that, these have been great connections to have and introductions that we've been really lucky to form. So sort of pulling out social media as an example. So, so in May, so this was before our ambassadors were brought on. I won't go through all of these numbers, but the ones I want to focus on are Instagram and LinkedIn, right? We were reaching people, we had a good number of followers, but it was less than what we were hoping. And then after, this is 4 months after we've had our ambassadors live, you can see that our Instagram page reach has just really expanded, as has our LinkedIn. And you might notice that our Facebook is not doing as hot. And I think a lot of this has to do with most of our ambassadors are Gen Z, right? Facebook is no longer the social media of choice. Instagram is, LinkedIn is, TikTok is. And in those areas, they're really, flourishing. So we've been really excited to see that increase. Some of the projects that they're working on. So we have a newborn screening task force where there's 10 students who are on the task force, and we've divided up all 50 states. So they each had about 5, where they spent the time looking at what are the newborn screening policies for that state, what conditions are on the panels, are there any lysosomal storage disorders on that panel, are there any NPS, because that's specific to our condition. How did new conditions get added for that state? What's the cost per person? So they've really done a great job of this first round of breaking it down into very manageable, a fantastic database, to be honest. And our next step in 2022, in the spring, we're going to take that database that we've created, and we're going to figure out, which states seem to have, they're more lenient on letting in conditions, or they have other lysosomal storage disorders that have done well, and encouraging them to work in pairs to reach out to those states, see if they can have a conversation. We actually have some newborn screening committees that are going to send a representative to talk to our group. So we're very interested in exploring that. They're also going to be creating action sheets for each of the states where we have a family member present, help them encourage engagement in legislation and policy in their own state. We have a new committee that's been formed called donor engagement. So we want to engage donors, increase our retention, finding ways to reach out, thank them, get them engaged in what we're doing. So they're very excited to do that, and they're going to be serving on our development committee. And then I've already talked about social media, brainstorming new approaches. Our biggest call out is TikTok right now. So some lessons that we've learned, we only have 2 slides left, and then I would love to hear your questions, was the importance of specificity, right? Our ambassadors are more successful when they're specific tasks and instructions, especially in the beginning, right? When they're still figuring out what the foundation is, how do I advocate? Being able to give really specific ideas and then help them, implement has been really, really helpful. Building connections, taking the time to understand.
Well, I think we got a little blip in the internet. Let's give Brenna a second.
I'm sorry, am I back?
Yes, you're back now, Brenna.
I'm so sorry. I'm like talking away, like.
Made it almost through the entire thing.
Okay, yeah, we're almost done. Okay, yeah, so building connections, really trying to figure out what their strengths and interests are to be able to build upon that versus asking them to do something out of their comfort zone. And then motivation. We have found it really important that maybe one of the top things to look for in the future is to really have someone who is a self-starter, has initiative, because we will present lots of opportunities for them to get involved. But as this is volunteer-based, it's really going to need, they need to be motivated to pursue it and to make the most of it. So that's something, and we've been really lucky with the ambassadors that we've had this year, but just something that we've noticed will be helpful to build upon. Last slide, thinking of what's next, we want to continue to develop opportunities, task force, committees, et cetera, that they can serve on. And a lot of this can be driven by their interest. What do you find is a need? What do our families think is a need? And then build those opportunities up. We're also going to be expanding our program. We started this first year with pre-health students because that's kind of what made sense initially, but we've quickly found that we need marketing students and communication students and business students as well to really help build with our social media and some of our donor engagement, et cetera. So we will be, casting a wider net in terms of, majors or backgrounds when we move forward. And we're going to continue. We want to eventually really have a national reach, right? These are places that we would not have been able to reach without the ambassadors program, and we want to build that up. And we actually have a couple of international students that have reached out in countries where, we know we have families there as well. So that might be something that we're doing in the future too, is we might have a few international students as well. So yeah, so that was really fast, but hopefully it was helpful. We're, by no means done. This is an evolving work in progress. We've been really happy with where we are so far, and we felt really blessed to the ambassadors that we've had, and we're excited to see where this goes. So I'm gonna stop sharing, but feel free to follow us on social media. Mary wanted to make sure that I threw that out there, our marketing director, and you're welcome to contact me if we don't have enough time at the end and there's more questions. So that's included as well.
Thanks so much for that, Brenna. Wonderful presentation. Looks like we already have a question in the chat. Feel free to unmute yourself if you want to expand, but it looks like where do you find access to genetic counseling programs and medical school programs?
Yeah, so that's a great question. So I was definitely very lucky in the genetic counseling space because that was, my background. So I'm a member of the National Society of Genetic Counselors, so I could post it on different forums. There's also a listserv for all of the genetic counseling program directors. So I could send it to my director and was like, can you please send it to like all of the other program directors too? And so there is a way though. Oh, sorry, I need to not get distracted by the other questions coming in, but there is, a way to reach out to a genetic counselor, or there are guest memberships to NSGC, or find someone to post on your behalf. Medical schools, my husband's in medical school currently, so I had access through that, but there's lots of medical students and programs. If you can even ask your, physician that you see who's a primary physician for you or for your child, be like, where did you go to school? Like, do you have contact with your, classmates or your program director, and have them share that way. So there are lots of avenues. There's also Discord channels, which is a platform where people have with common interests post, and there's lots of pre-whatevers on there, and you can post in those channels the opportunities as well. And we got a lot of people from there.
Great. Thanks, Brenna. I think you already saw another question in the chat. Do you offer any type of compensation in the form of hours served or CMEs?
So ours is not currently a paid position. So we will sign anything in terms of like volunteer hours that they've done as they're like applying for schools. For some of our students who are serving on the conference committee, it's going to be in Philadelphia. So we are planning to fly them out there and pay for their hotel and whatnot. So that will be, kind of a compensation and sense of like work done. And for current students, they don't yet need CMEs because they haven't graduated yet. So they don't need continuing education yet. Emmanuel, oh, sorry, I need to click on it to see the rest of the question.
Yes, we have a nice long question in chat. I'll read it out loud for those without the visual. Do you have an ambassador manual that you would be willing to share? Typically, when we think about ambassadors, we think about patients and their families, but the idea of medical students, genetic counselors, et cetera, is amazing. So a two-in-one question and compliment.
Yeah, so this is brand new, so we haven't written up what we've done. However, I'm more than happy to share what we have. So you can have these slides. I can meet with you one-on-one. I'm happy to give you, our slides from our orientation, and what the application looked like. I think we will write it up eventually, but we've only been at it now for about 4 months. So unfortunately, not yet, but we've been so impressed with these students. So I think everyone should give them a chance if they can. They can do a lot of great things.
Definitely incredible to see what you all have already done in just 4 months. Wow. Are there any other? Yeah, for sure. Any other questions either in the chat, or feel free to unmute yourself if it's easier to ask. Oh, looks like we got another message. I'll read this one out loud for the folks at home as well. Great info, thank you. We've learned the hard way that relying on families impacted by the disease rarely works. I've also had firsthand experience that these pre-health students really need resume material. Did any of the ambassadors help with the registry in any way?
So we do have a couple of students that are very interested in research and are currently serving on our research committee. So they are helping in the general terms of thinking of, what would be good information to capture, what are some missing gaps? This is what I'm seeing in school and it's a new idea. That's the other great thing about having current students. They're in the programs right now learning. And so they might be like, oh, I just read this paper, because they're probably more in depth, in the current literature than we are, and can help lead those ideas. But we haven't put anyone on it super manually, because we would need to update our IRB to have them like work inside of the data. And if these are 2-year positions, I don't know if I mentioned that, it's a 2-year commitment. Some of them will roll off after year 1 for this first batch, just because they are graduating and then moving on, not because they're not doing a good job, but because of that like sort of quick turnaround. We haven't thought about adding them yet to our IRB. We're also personally still really working on launching our patient registry, which, as Matthew knows, it is not up and going, by which a lot of you guys have. Probably is going really well.
Great questions so far. Great answers. Thanks, Brenna. We are at the half-hour mark, so to be respectful of time, Brenna, I believe you indicated you'd be willing to take questions. If you want to put your email in the chat, just so people can note it down and reach out to you that way. But thank you so much to everyone who attended, and for those of you watching this recording, sorry you weren't able to attend. Feel free to take a look at our website at geneticalliance.org. We have our other lessons from the field. You'll be able to view our upcoming talks, upcoming speakers, and information on both. Thanks again to everyone attending, and a big thank you to Brenna for presenting to us today, and hope everyone has a great rest of their day. Great, and there's Brenna's email in the chat.
I was a little slow, sorry about that.
No, you're good. Thank you so much.
Thank you, thanks for having us.